Health Ambassador Fellowship grew out of a desire to invest in immigrant health in the most vulnerable areas and with the most vulnerable communities. The program envisioned building greater capacity for community members and organizations to address health and be at the forefront of the fight for health justice. The program placed 5 fellows in 4 key regions. We chose Bakersfield in Ontario because both lack safety net programs for undocumented folks, LA because it's a hub for immigrant communities, and Sacramento to be able to inform policy. Each fellow was able to do vital work in these regions, and just as important, they were able to develop as leaders and professionals.
Especially seeing all this process of the administration really trying to take away healthcare access to over 24 million people that were going to get affected, plus the people that are already uninsured. I think it's even more important to make sure that everyone has a chance to have access to healthcare regardless of citizenship status. And I think it's a good moment to really expand that narrative that healthcare had nothing really to do with citizenship, if not with the people and with the people that need it, and sickness is not out there picking out who has citizenship or not, so why should healthcare have to be selective in that way?
I think it's important to have a health ambassador in the Inland Empire because we are actually one of the counties that has very limited services for undocumented folks when it comes to health. Out of the 58 counties, we are one of the 11 and one of the biggest counties also that does not offer any type of safety net program or county program that offers medical services to undocumented folks. So I think it's important to have somebody in the Inland Empire who's advocating for health access for everyone.
So for me during the fellowship, I think I'm working on it right now, and that is creating a mental health list for the state of California, like what resources are available for folks that are in need of like mental health resources, specifically with the political climate that we have right now. There's a lot of anxiety, panic, even like coming from personal experience, and how we can help support and bring out those resources to the community that needs it. So to me, that's the most impactful work that I'm doing right now, being able to create that list that would be able to go out to the community, to share with the community, to be able to access those resources.
Personally, in the sense of I have lost the anxiety of social interaction, even though a lot of people couldn't tell that I had that social anxiety when I interact with people. But now with doing presentations, having to canvas outreach, talking to people constantly in this fellowship at Clinica Romero, then I had to lose that fear, you know. And right now I can be in front of a crowd and I can speak to them, giving them a presentation without having that type of anxiety. And I think that's really cool. I developed my public speaking skills.
My favorite part of Health Ambassadors is I felt welcomed and I felt like I've been around, I feel like my second family, and it's a diverse group of people and we're all in it in the same thing together. This program has made me really happy just being part of it. I'm really thankful and grateful. It's helped to like bring more awareness and to let people know that there are programs out there and people are willing to help. So it's just about informing yourself and doing your research.
One of the ways that the Health Ambassador program has benefited our region, I think one of the things, just having the presence of somebody doing health work within our region. I think before the Health Ambassador program, there was people that were focusing on health, but they weren't focusing on health for undocumented folks. So I think the Health Ambassador program allowed us to continue conversations, then being able to get healthcare access.
The fellows continuously advocated for health access in their regions. They grew in their agency to enact change, and most importantly, led from a place of a lived experience. From community presentations to speaking on panels, organizing events, and overall building community with one another, the fellows have and will continue to fearlessly advocate for health justice.
It's nice to see not only the youth, but the educated youth, the older people are also staying active, and they're seeing what's going on in the communities, and they see that we need programs, we need resources, we need more opportunities, and it's nice to see them to get their voices heard, because at the end of the day, your voice matters and your health matters. That's what I want to say.